Hello, good afternoon, everybody. My name is Maria QU. I am the Medical Services Manager for Greenslopes. Welcome to the presentation regarding our internship program here in Greenslopes. Can I please just request for people to confirm that you can hear us clearly and can see what we're sharing, screen sharing clearly as well? Thank you. Thank you, Daniel.
Right. Beautiful. Yeah.
Thank you.
Brilliant.
Okay, we'll make a start then. So as I've said, I'm Maria and I'm the Medical Services Manager. I'll let Tom introduce himself.
Yeah, hi everyone. My name is Tom Coe. I'm the Medical Education Officer here at the hospital. Thanks for joining us today. We are going to run through for probably about 20 to 30 minutes some information regarding obviously the internship here at Greenslopes and what that would look like for you if you were to be one of the people that come here as well. And yeah, please let us know if there's any technical issues at all as we go through the presentation slides. Sometimes there are little hiccups, so just don't be afraid to unmute yourself and jump in. And we also do invite questions as well. We'll obviously cover a lot of information in the next 20 or so minutes. You are welcome to ask some questions as we go, but if you prefer to be a little bit more anonymous, you're also welcome to use the chat, and we will jump into that towards the end as well, and we can catch up with any questions that may have been missed during that time. All right.
So we'll just give you a brief introduction about the hospital, Greenslopes Private Hospital. That is the entrance that will welcome you if you do decide and you are successful in applying as an intern for us for 2026. Greenslopes Private Hospital is a 700-bedded bedded hospital. It's private, and yet we have 700 beds that's licensed for use. We have a 24-hour emergency center. It's a non-trauma emergency center. We could get up to 80 to 90 presentations in a day, sometimes up to 100 as well, presentations in EC. And we convert at least 40 to 50% of that as admissions into the main hospital. So that's how busy our emergency center is. Specialty clinics are also available, which ranges from plastics to gen med. We have our pre-admission center as well. So that's a very big part of what Greenslopes has got to offer when it comes to specialty clinics. We do offer pediatric surgery that is only elective, so very low risk. We've got our adenoids and tonsillectomy that happens, overnight stay or even a day case for some. We have 18-bedded ICU, so that's intensive care unit. We've got 18 licensed beds. We have 29 beds in our coronary care unit, and we have 3 cath labs. CCU and cath lab is located adjacent to each other, so it's very accessible. We have 27 main theaters, and that includes robotic surgery, which within a couple of our main theaters. We have 26 beds for maternity, post and prenatal. We have 7 birthing suites, and we have 10 bassinets or cubicles available for special care nursery, and that's level 4 nursery care for babies. We also have a radiation oncology and PET scan, and that is called the ICON. So we provide that. We've got that on site. We have day oncology. We have a lot of resources available to enable our patients with cancer to live a pretty much near normal life, having their treatment, day therapy done, chemo, and that in our Cyril Gilbert Cancer Center. We have a mental health facility purely for our veterans, and it's called the Keith Payne Unit. It's a 31-bedded ward, mainly dealing with patients who are admitted with PTSD. And we have a rehab unit, 45 beds, and we also have a day rehab gym that is multidisciplinary in approach. We have an OT, physio, speech, social worker, all involved in helping that patient progress and into their rehabilitation program. So that's Greenslopes Private Hospital, a very busy 700 beds private hospital that provides a lot of opportunities for learning.
Okay, so you've heard a little bit about the infrastructure at the hospital, and there's a little bit more. Obviously, given what Maria's just gone through, it's probably not a surprise to you to know that Australia's largest private hospital is Greenslopes. Over 25 years of training experience here that's been provided. There's other infrastructure as well, which we can note, and some of these are already born of a good collaboration with UQ. We have the Shared Simulation Centre, which is the Francis Barron Burnett Centre, and that's a UQ joint Greenslopes adventure, and it's been running for a number of years up the top of the hill there for people that are familiar with the hospital. We've got a lot of tutorial rooms as well here. We've got 5 UQ tutorial rooms that are typically used by the students, as you know, and also some of our doctors as well here for further teaching. But we have other areas of teaching, including up on the wards and things like that. We have the on-site library or the JMO lounge and some other conference facilities as well, where most of our protected education each week does happen. We have over 100 junior doctors in training folks at any given time here, and that includes interns all the way through to advanced trainees. We're accredited to provide training to PGY 1s, 2s, 3s, which are typically your pre-vocational doctors. And then we do have here at any given time quite a number of SHOs, PHOs. We have registrars, advanced trainees. We have people who do basic physician training here. And we're in a level 3 accredited facility, which means ultimately that if someone's doing physician training, they can be here for about up to 3 years to do that training. It means, though, that ultimately there's a breadth and depth of medicine here for those physicians. Most hospitals are typically a level 1 or 2. It's very rare to actually have a facility that would be level 3, certainly in the private space. It's typically only the public hospitals that would have that. The advanced training in surgery as well as here, medicine, emergency, intensive care, radiology, psychiatry. There's a whole heap of robotics here as well, including Da Vinci robots that Greenslopes has. So if you are surgically inclined, you'd be exposed to very advanced surgical medicine here as well. University of Queensland Clinical School campuses on site, and we also have Gallipoli Medical Research Foundation. So if any of you are interested in trying to get involved a little bit more with research, or if you have an interest in clinical trials, there's definitely avenues to look into there as well. So on to the next slide. It is, yeah. So one moment, folks, I'm just checking something. So the experience with the internship program, this isn't our first rodeo, so to speak. So it's been running actually for now over 10 years here. It started in 2014 as a Commonwealth funded internship program. And during that time, we've trained approximately 600 pre-vocational doctors. Sort of towards the end of this year, it's going to round up to about 625 pre-voc doctors, or a bit more than that. And we have well-established networks across Queensland Health and the Northern Territory. Some of you will already be aware that we have rural site rotations. So there's a term where our interns will have the opportunity to head off site to a number of different rural or remote places, and we'll look at them a little bit later. And it's really great experience because it gives you a breadth, again, of skill development, exposure to rural medicine, and also it allows you to understand a little bit more about doing a lot less, or sorry, a lot more, I should say, with a lot less when it comes to resources, and understanding, appreciating some of those interactions with First Nations people and providing healthcare to a lot of underprivileged people in different communities as well. So on to the next slide. Thanks, Priya. So this is the ultimate question. This is probably why the crux of why you're actually in here today, which is, why is Greenslopes Hospital a good internship program for you? There's a number of different reasons, and some of them are the real obvious ones around the supervision that would be afforded to you. So you have very good supervision. The consultants here, they're not necessarily remunerated for their time as supervisors. they do that because they have a passion for developing the next crop of doctors. It's effectively that, and their supervision is very high quality. We do get a lot of good feedback from our JMOs around the consultants, the supervisors here. A lot of opportunities for your learning as well. And I'll talk a bit more about the protected teaching soon, but there's other opportunities probably beyond just the standard intern and JMO teaching that you'd go to. The real opportunity that would set Greenslopes apart to, say, a public hospital would be your interaction, your networking, your collaboration, your relationship building with the consultants. That would be a huge difference between this private space and, say, a public appointment. Typically in a public hospital, an intern, their escalation pathway would be to a registrar and in some respects sort of end there. And most of the ward rounds, the teaching and that interaction is with your registrars in the public space. Here at Greenslopes, you're actually with consultants for the vast majority of your time, particularly on rounds in the mornings. A lot of our teaching is facilitated by the consultants as well. So you do get to know some of the bosses and make some really good relationships. You're well supported here. In terms of the medical services unit, medical education unit, it is very much an open door policy. One of the benefits of Greenslopes is whilst it's a large hospital, it is quite intimate. We have very good pastoral care here. We do get to know you. We know a lot about sort of your goals, your objectives, where you've come from, and we do take pride in really supporting our junior doctors and making sure that we provide them not just good training, just good supervision, but we want to provide them with that real holistic support during their internship year here, and making sure that they're happy, that they've got good social connections, that they feel supported in the hospital, and that there's a lot of good reasons to get up and come to work every day. And that's something that we do really focus on, because we understand that's a huge aspect in your work life, also being happy and having support from your actual hospital as well. Like it says there, the small hospital feel, and it really is small hospital feel. You get to know a lot of people really quickly here and you become one of the team. The private model is what I've alluded to earlier, which is you get to have insight around how private healthcare works as well. And it's not a bad starting point for you to develop a little bit of an understanding of how you may one day also progress into consulting in a private healthcare setting. So you would have quite a unique look into the private healthcare sector. And then obviously the patients here as well. We have lovely patients at the hospital. Very eclectic. We have a broad demographic of patients that come in, and for that very reason, the medicine is challenging, it's interesting, it's unique, and it's ever changing as well. A couple more things. We have rural education, which will effectively be rural allocations, and we'll elaborate a bit more on that soon. But we have a number of different sites that during your internship you could potentially go to, right up to the Cape, which is Thursday Island on the tip of Queensland, and all the way out west towards Alice Springs, which is the Northern Territory, where we have other sites there as well. So then there's also country and rural places, Gundawindi, Kingaroy, etc. And they all offer very unique experiences, but really wonderful times where for 10 weeks you get a chance to really supercharge your skill set. So the rural stuff is great, always gets really good feedback, and it's something that I think most doctors really do feel like they've grown an extra leg when they come back. Education-wise, we have protected teaching here every week. We actually have a lot of teaching at the hospitals. The protected stuff is Wednesday intern teaching for an hour. We have grand rounds education, which is hospital-wide, and that's for an hour as well. And then Friday, we have teaching for the JMO group, which also includes the interns. That's an hour. It's always around the lunchtime mark. We provide lunch at all these sessions as well to make sure that you're topped up and ready to go. It is protected time, so the pages and the phones, we'll collect them from you to make sure that you actually have a genuine hour to actually take on that education and zone out a little bit from what's happening on the wards. And then there's actually a lot of other ad hoc education we do here as well. If you speak to some of the other UQ students, for example, and I've gotten to know a lot even in the first half of this year so far, I see a lot of UQ students come to the intern, grand rounds and JMO teaching every single week. And they're welcome. That's an open door policy every time. But they also come to a lot of the ad hoc stuff that we organise. And so we do things like ECG Club, which we've started this year. We've had a few sessions already. We have, cannulation sessions, skill sessions. I organised about 2 months ago, actually, a couple of UQ students that approached me saying they needed to tick off some plastering experience. And by the end of the day or the following day, I had them with one of our registrars from orthopedics doing a sort of a very bespoke plastering session. The beauty of Greenslopes truly is that we do get to know you, and we've got some really good teaching culture here with our registrars and our VMOs. And a lot of the time, we can organise education pretty quickly to fill some of those gaps, those interests, those requirements, and you'd be no exception in terms of that intern program as well. So I have covered off some of these in terms of the intern, teaching, JMO. There's also departmental and unit-specific meetings. These do vary. Sometimes they're weekly, they could be fortnightly, they could be monthly. For example, if you're in a general medical rotation for 10 weeks here, then every week on a Monday, you would attend the Division of Medicine meeting. And that's where effectively all the consultants, the regs, everyone gets into the room and they look at some pretty specific cases and do some further education there. We do have also ALS and skills training. With our orientation program, we build into that the ALS component and a lot of those really fundamental procedural skills. However, we do have skills that run all year round. So we'll do things like NGT, IDC, IBC, very systematically and routinely from week to week, and you'd be scheduled to attend those sorts of programs and those skill sessions quite regularly. We also do other things like medicine codes, simulated patient scenarios. We do BLS and PEDS ALS. We do a cruise course, which is quite a more robust medical training workshop that you would do prior to a rural rotation. So there's actually a lot of education happening here, particularly in that really hands-on procedural area. The informal stuff is really great here too. So we have a lot of ward rounds, bedside teaching, and small group teaching as well. A lot of units have departmental teaching, which they do on week to week or fortnightly basis as well. The bottom line is, whether it's each week or almost every day, there's probably something cooking for you to actually attend in terms of education here. And if there wasn't something that was sort of up your alley, or if you felt there was something you needed to actually brush up on, just having a chat with me, there's probably a good scope to organise something pretty quickly as well. Okay, so we're just going to give you a quick saturation of some of the great photos that we've taken over the last 12 months or so. But as you can see, the grand rounds with our international guest speakers that have come in, JAM education sessions such as the voluntary assisted dying. We've got on one of the photos there, you can see the looks like the ultrasound guided cannulation session that was run by one of our registrars here as well. Every week there's something. You're seeing here now the trade exhibit. The trade exhibit is something that we build into the intern orientation, and effectively we get all of our allied health groups in, we get all the referral crews in, so some of the Nicolaides, Queensland X-ray, everyone comes into the room, and we give you a chance to pretty much just familiarise yourself with all their bits and pieces, but understand how your relationship with them here in the hospital works in terms of, not referring to them, but understanding their point of in the patient care process as well, and how you can actually lean on people and have some of those good relationships and connections from pretty much day dot, or at least the first week of being here. And a couple more grand rounds. Another photo you can see there, that's Dr. Stephen Allison. He's one of our general surgeons here at the hospital. He also has a public appointment as well, as many of our consultants do, but he was here actually doing a bit of a masterclass on, I think that one was the acute abdomen, and really interactive stuff, a lot of Q&A. He's a bit old school. He gets out the old whiteboard and pen and likes to really quiz the room and work through and make sure it's, everything's covered. And probably one of the last things I'll speak about before Maria talks a bit more about some other rotations, the High Fidelity Sim Centre. Just to note, at the top of the hill here, that's the one that UQ and Greenslopes share. And there's pretty much every toy that you can think of inside that centre that you may be able to actually familiarise yourself with, and certainly a lot of skills training comes out of there. The conference rooms are great. They're really set up for big group sessions. We can have 50 or 60 people in those, but we also use them for those more small group sessions where we just have a dozen people or less doing some more specific stuff we've organised. Yes, of course. And then I should also note the AMA conference, mock sims. With the AMA conference and other conferences, we do have opportunities for research as well. So you may like to do some posters here or do some research projects, and there are opportunities to head off and present those at different conferences throughout the year. And you would definitely have the support of Greenslopes in pursuing those sorts of things as well. All right, next slide. Maria.
Sure, thank you, Tom. So now I'm going to share with you some of the usual rotations on offer here. Well, not some, but all of it actually. So first one is we do have Greenslopes specific emergency rotation. So you will, if you, based on your preference, if you've preference to go to the Greenslopes emergency, we'll do our very best to accommodate that request and send you there. It is again a 24-hour emergency center, non-trauma center, but we do get up to 100 presentations in a day. So if you, it's just giving you that context that it is a busy center and you will get the training and the learning that you require, the exposure that you require. We have gastroenterology, general medicine. We have the following main teams. We have 4 main teams in Gen Med, so that's listed with the specific consultants there. We also have a geriatric rehab rotation. Then we have respiratory, hematology, renal or nephrology, oncology, infectious disease is also available. We have general surgery. There are actually 3 teams there, so that the capacity to absorb, if your preference is gen surg in particular. And then we have neurosurgery, orthopedics, plastics, and urology. We also then have our external sites where you get the opportunity to actually practice rural medicine. And as Tom has mentioned earlier, these are the areas. So Thursday Island, Bamaga, Alice Springs, which is in the Northern Territory. In Alice Springs, you can do surgery, medical, or surgery-specific orthopedics and emergency. You also have a rural rotation to Gondowindi, Kingaroy, where you can do emergency and rural generalist, Cairns Hospital, which at the moment is only for our PGY2s, but we're working on getting that accredited as for our PGY1s, for our interns. We also have Cooktown and Weipa. We've mentioned about the external rotations, the rural side. So it is an expectation, it is a requirement, it is a mandatory requirement, contractual obligation for every intern, actually for every doctor that's employed within Greenslopes. We have that arrangement with the private hospital stream, which is the program that we supports us supporting our interns and residents, that we are able to send a doctor in the 12 months that you're here with us for a whole term. So if the term is 12 weeks, you're there for 12 weeks. If it's for 10 weeks, you're there for 10 weeks. We provide the accommodation, so that's paid for the 10 weeks or the whole term that you're there. We also cover your flight or your transport to and from the rural site. And there is also, we also cover a couple of things that we can provide reimbursement for you. So that could be your internet provider for the length of time that you're there, and also the gym. And in Northern Territory in Alice Springs, we also provide support if you want to become a member of their RMO forum. The RMO forum in Alice Springs is quite an active one, and they provide you an opportunity on your days off to see more of Australia, see more of Alice Springs and the surrounding areas. So it's quite a good rotation. And even though you're off-site, we still provide the support and the guidance that you need, because of course we are still your employing hospital. These are some of the beautiful pictures taken by doctors who have rotated rurally. Some I think you've taken, Tom. Or yeah. This is Gondawindi. So we were there last year visiting two of our doctors who were rostered there. Dr. Gerard Connors is our Director of Clinical Training at the DCT, and he travels with me and Tom as we visit the sites. Here are a couple of our doctors that's who were here last year, and they were actually in Alice Springs, not in in Kingaroy this time. They were in Kingaroy. And this is Alice Springs with a couple of our residents there on their days off, exploring the beauty of Alice Springs. We also have a few activities and initiatives here because we're all for the well-being, the pastoral care, and making sure that, we're able to support you, not just on the education, not just on the employment, not just on the internship thing, but holistically. So we have Crazy Socks for Dogs. And at this point, Tom has organized a competition for our doctors to showcase different types of socks. And as you can see, we have the grand winner there, and our runners up there with their socks. So it was a fun activity. It was very light.
Yeah, and just on the topic of well-being as well, before we talk about the recruitment process. So we do make sure there's plenty of things for you to engage in here. We do have like a staff social club, that's one avenue. The other thing that we do every week is some Thursday trivia in the JMO Lounge, which I run, prizes every time, plus glory for the winner. We also do things like Crazy Socks for Docs. We do coffee catch-ups every few weeks as well, where I'll just pretty much send out a notification to every intern, every resident, just saying, send me your order, and we'll get together and just have a bit of a catch up. It doesn't have to be work-related talk either. It's just a time to have 15, 20 minutes to sort of relax a bit, have a coffee, and we do that quite a lot, to be honest. And, there's other things throughout the year as well. Other little initiatives, little projects. We had a competition last year, Foods of the World, where all our doctors, brought in a whole heap of native dishes and cuisines and things that were their comfort food creations, and we had a bit of a contest to see who was the best, who was the master chef, so to speak. So we do things here as well to keep you active and light.
Okay, so now for the more serious part, which I think would be where most of your questions would be coming from. So hopefully the next few slides will answer most of your questions. But again, at the end of the presentation, we're more than happy for you to send through your questions. We can see it on the chat as well. If you feel you want to ask the question during the presentation, that's fine with me as well. But probably just give me a chance to finish most of it so you can see if I would be able to answer them already. So the first part really is about the recruitment process. So we would always refer you to look into the website for actual accurate information, and the website will be your Junior Doctor Training Program, your JDTP, Private Hospital Stream PHS. So what is the JDTP PHS? Is the best way I could summarize what it is that it's a program, an initiative from the Australian government under the Department of Health and Aged Care that provides support to private hospitals like Greenslopes in order to have doctors like yourselves, interns and PGY2s, to have that opportunity to work in a private setting and at the same time have an opportunity, that exposure to work in the rural setting. Is providing doctors and access to doctors and healthcare, not just for the private, but also for our rural partners. Now, there are a couple of there's two priorities or categories within the program, the PHS. I'll just refer to the JDTP PHS as a PHS. So the priority 1 and the priority 2. Priority 1 will be your non-Australian citizens, non-Australian, non-New Zealand citizens or permanent residents. So you need to also be a full fee-paying international student, and that your education should be based here in Australia, and particularly for our cohort here in Queensland. But of course, we still do take others from interstate, but each state will have their own recruitment process. So at this point, it's your priority 1 will be your non-Australian, New Zealand citizens who would complete your medicine, your degree in medicine in 2025. You would have completed your English test as well, and you would be then eligible for provisional registration. So that's our priority 1. Now, our priority 2 category cohort will be those that are still able to have met your English test, that you would be eligible for provisional registration. And so your priority 2s are those that who would have completed your training outside of Australia, but then you need to be eligible for provisional registration, which means if required, you would have completed your AMC 1 and AMC 2, and therefore would be eligible for provisional registration. We request, of course, that for both priority 1 and priority 2, that you would, it is an expectation that you would be completing for yourself the APRA registration for provisional, and you are also going to ensure that you have your working rights, you have your visa to work here in Australia after your student visa, before your student visa expires, really. We also expect that your details that you will be submitting when you apply for the internship program here in Greenslopes will have your current details. Your email address is accurate, your contact number is accurate. The references that you would be providing when you apply into the PHS, it's best for your best interest that it will come from your consultant that you're working with at that level, so that they're able to provide a better feedback of how you've performed at the level of working with a consultant. The interviews will be via Microsoft Teams. The interview is very basic. We're going to ask you what is your career pathway. I know it's very early on. You're just completing your degree and then you're doing your internship program, but we also want to see what is the career pathway, just to have a better understanding, because we want to know the doctors that we who choose to work with us and that we choose to actually work with us as well. We'll be asking you why Greenslopes, basic question, and there will be a question regarding situational awareness, meaning we might be asking you a question. It's not a trick. It's basically asking you a question about how, if you were asked to perform, for example, if you were asked to perform a task and you're not sure about the task, what are you going to do about that situation? So again, the situational awareness part of that. And then we will also be posting a clinical scenario. A basic clinical scenario could be you're the intern who's rostered that particular day, you were with, you've arrived on the ward and the nurses have said that this patient is having chest pain. So it's that clinical scenario and us finding out how you're going to process and navigate through that scenario of you're the intern, you're first on scene, and there's a patient having a chest pain. So again, they're not trick questions, but it is for us to see if you are able to demonstrate during that interview that you are a safe practitioner, you know your boundaries, and you know the basics of medicine really, because that's very important because you're applying to be a doctor, to be an intern. The offer process has got a very tight frame. So once the dates are out for the PHS, we will be able to provide you a more accurate account of the dates. But usually, once the PHS releases that list, and you have chosen us as the hospital of choice to do your internship program, we will be sending to you an interview invite. And once we complete the interviews, we will then provide the offer based on the timeline of the PHS. And once we're able to provide the offer, we give you 24 hours to respond to that offer, and then we proceed with onboarding you. It's a very tight time frame because usually the interviews happen around late October, beginning November. And as you can see, that just leaves us December and January to get you on board on the 12th of January. So if you do decide to come to apply for us, we provide you the opportunity to be interviewed, and then you are successful and we offer you, we give you 24 hours to either accept or decline that offer. Just because of the time frame, we want to be able to get you onboarded in a timely manner instead of a very, very rushed experience for yourselves and us. I've already explained the priority 1 and priority 2, but I will just, if you want to take a photo of that one or a screenshot or something for you to refer to, it just explains the difference between the two priorities. So bearing in mind, obviously, once we start the recruitment process, Greenslopes as the recruiting hospital will then be able to access the priority 1. Once we've exhausted the priority 1, that's the only time we can move and look into the priority 2. The dates for the internship program via the PHS is yet to be confirmed, as I've mentioned earlier. Again, to reiterate what I've spoken to about earlier, being prepared yourself. So we expect that you would be managing and organizing your APRA, your right to work here, your visa. The contract is for a year, and that is because we are under the private health stream, and that is a yearly reviewed agreement with the Department of Health and Aged Care. The pay and leave entitlements are in parity with Queensland Health. So if the pay scale of an intern is this set amount, it is equal and the same here in Greenslopes. We are also in parity with regards to the leave entitlement. So if it is 5 weeks of leave entitlement for a Queensland Health employee intern, it is 5 weeks with us as well. SurveyMonkey will be sent out as soon as you have been offered the internship job and you have accepted it, and you will be able to put your preference allocations through there and your leave allocations. Our leave allocations is a 5-week block. It's a lot easier for us to manage the 60 odd doctors with regards to leave. So we always, at this point in time here in Greenslopes, we have your 5 weeks block and we match it with your leave so that it also doesn't have an impact in your training or your core requirements. So, and it's usually going to be either one of the teams that you have preferenced, and as long as you're still meeting your core requirements, then we can work around that as per your preference. No leave can be taken during your rural rotation because obviously if you take leave, that won't you won't be able to comply with a 10-week term in the rural. So there are 47 weeks of work, and you should be able to complete that, your core term requirements and that. The orientation week starts the 12th of January 2026, and that is we provide a week of intern dedicated orientation that myself, Tom, and our Deputy Director of Medical Services work on really hard in providing a very good orientation program for the interns for that whole week. There is a question here, in terms of reference and all the EOI application process, will them all be completed online? Yes. Yes, they're all online. So remember, I've asked you to take a screenshot of this, the private hospital stream, Australian Government Department of Health and Aged Care. It is, if you keep an eye on that one, they will provide an updated internship key dates for 2026. And these are the rest of the useful links. If you'd want, again, to take a screenshot of that so that you can refer to them with regards to, again, the PHS program, Medical Board of Australia when it comes to international medical graduates, the AMC certificates, and these are the very useful email addresses for myself. Is there GMO Education is Tom's generic email, and then our admin has got their generic email, and this is our phone number, our generic phone number. Any questions?
How competitive is Pathway?
I think it's quite competitive because there are not all of the graduating final year medical students are aware. And I don't know why, to be very honest, because it's been running for more than 10 years, but it is very limited of the amount of people who actually know that Greenslopes offers a very good internship training program for our cohort of doctors. It's quite competitive because, as you know, the public system, their time of interview and allocation of their interns happens around June, July. So, and whereas our one happens around October, November, because obviously the priority is the public health hospitals. So then with the PHS, the competition is quite tight because obviously you will get those doctors who are sort of overflow from the public system who have not been given a chance or opportunity to get to into an internship program within the public health system. So I believe it's quite competitive. We do get a lot of those that don't fit the priority 1 and priority 2 who want to work here as well. So it's a good combination, really. Anything to add?
No, I'd probably just add that in terms of competitive, I think a lot of the pathways, whether it be, you know, you're trying to get through the public system and you really want the Royal or you want the PA, or if you want to come to Greenslopes, it's probably much of a muchness that there are going to be a number of people who are also applying. So probably the thing to keep in mind is that nothing is a guarantee with any of the pathways you apply, but you need to apply the one that you think is probably the most suitable and best fit for you in terms of you as a learner and in your training needs. I think it's very easy to fall into that pitfall of just thinking, I'll apply to just the public pathway and I really, really want the Royal or something like that. I think that can really box you in, maybe leave you for disappointment. It's important to think, what do you actually want to get out of your training year? Are you someone that actually wants to, for example, have some rural or remote medicine exposure, and what will that do for you as a clinician? Are you someone that wants to form relationships with some of the consultants, or if you just want to work purely with registrars the whole time? You've got to consider those things into what pathway is probably going to be best for you. We've outlined the key ingredients and components of Greenslopes pathway. If you do apply here, there's a very good chance you would get a position here, but nonetheless, you've got to polish up and be ready for the interview and make it count, because we have our high standards. We offer the very best clinical care to patients as well, and we want interns that are ready to deliver really high quality care as well. So it's probably a mix of many things, but all pathways you will find to be pretty competitive. Yep. Are there any other questions? And you are welcome to, you can unmute and use the microphone as well if you wish.
Yeah, we do have, sorry, that we didn't offer, Sarah, sorry, thank you for that. We didn't actually mention, but Greenslopes Private Hospital is able to offer to 34 interns. I think we're the highest number of allocations for interns in privates in the PHS.
Yes, we are.
34.
Are there any other questions? You are welcome to use your microphones as well. I think someone was going to unmute themselves too.
Yeah, hi, I have two questions. Thank you for holding this info session, first of all. The first question was, I'm going to be doing my elective abroad during the period that offers are sent out. Do I put in, well, I'm going to be in the States, so should I put in my American number, or will you contact students by email?
So we will contact you by email, and then obviously, so will you be around during the interview, which is end of October and November? Or will you be in your placement?
Yeah, I'll be doing my elective during that time.
We will contact you via email, and then we will complete the interview and everything via Teams.
Perfect, thank you. And I read in the public stream, if you decline a public offer, you won't be given another offer. Is it different for the private pathway? So if I decline a public pathway and wait for Greenslopes, will that affect anything?
So once you've let's put it this way, once you've accepted an offer in the public setting, you are not allowed to accept an offer from us.
But if I reject a public offer, is that okay?
Yes.
Okay, all right, thank you.
Yes. Just for everyone as well, FYI, don't forget about the time difference between public offering and the PHS offering. So June, July, they will be offering, and then PHS, particularly Greenslopes, we won't be able to offer until November. Okay? That's just a difference with the recruitment process between public and private. One of the limitations, really. So you just have to make a very good decision. And as I've said, we have 34 spots, so you can be one of them. Any other questions?
Anything at all around rural rotations or questions around the training or the learning opportunities here? And if not, that's okay. But if there are questions, now is definitely the time to ask it. We're more than happy to answer those. How many applications that we had last year? Yeah.
Yes, yeah. We had about 70. 70 applications last year that we've received. No worries. Because we're offering so the question is, will Greenslopes be able to sponsor interns to obtain their employer-nominated PR? Because our offer is a fixed term for a year, that is something that needs to be worked out with an immigration officer or an migration agent, to be exact, because I'm not really sure if that 1 year is enough for us to actually sponsor you for permanent residency. I'm not particularly sure or certain of the rules now. But I originally thought it needs to be at least a minimum of 2 years. But again, I'm not a migration expert, so that's something I could ask my migration team about. But usually in the last couple of years, we haven't really encountered a request for that because it's a 1 year fixed term. So we haven't had that request to sponsor for permanent residency. No worries.
Hi, I just had a question just because you've mentioned obviously it's the 1 year, and I'm just wondering how it works in terms of the difference, because the public hospitals have kind of gone all to the 2-year kind of internship. Like, what's the difference like between like obviously yours and the public intern?
Yeah, so it is really because of, and I'm going to be transparent, it's because we're under the private health stream initiative, and that initiative is being reviewed on a yearly basis. So we cannot commit to a 2-year contract when we are running on a yearly contract review with the Department of Health and Aged Care. In saying that though, Katie, if in the event that the intern wants to stay with us, meaning stay for another year and do her PGY2 with us, that is something that we can consider. Again, pending on the renewal of our agreement with the PHS. So it's almost, if it is approved for 2027, our agreement with the Department of Health and Aged Care, and the intern wants to continue doing the PGY2 with us, then we sit down and then we discuss if we're able to continue that arrangement and agreement with you.
Amazing, thank you.
Thank you.
Well, if there are no further questions, we may actually just call it there. If you do have questions that come to you a little bit later on, though, you are welcome to contact either Miria or myself, and we can get back to you, or you can pop into the hospital as well and meet, and we can go for a walk, and I can show you some of the facilities so we can catch up. Otherwise, I think happy to leave it there.
Yes.
Yeah, we just want to thank you for your time as well, dialing into the Zoom presentation, and we'll keep our eyes peeled, and we look forward to hearing from some of you soon.
Thank you.
Thanks, everyone.
See ya.
Take care.
Thank
Bye.
you. Stop the recording now.
Yep.
Did you record?
It-
I'll
So
pause
just-
recording or stop.
Oh, it's perfect.
Recording is working.